Recently, the spread of mental disorders has become alarming. Hence our focus to enlighten people about it and how to deal with it. Not just the patient, but also family members, colleagues and friends. You must have guessed by now, my guest is Dr. Gbonjubola Abire. My name is Edakwili and this is Edakwili Show. Today we want to look at another form of mental health called psychosis with Dr. Abire. Doctor, welcome to our program.
Thank you very much.
I know you're a friend of the program. You will always call you back because you do a wonderful job each time we call you.
Thank you.
Please tell us, what is psychosis?
Yes. So before I state what psychosis is, I think it would only be fair to tell us what mental illness is. You say someone is mentally ill when they have a psychological or behavioral abnormality in which there is a problem with their behavior, their thoughts, their emotions, their sensory perceptions. So you always hear the loose term, oh, he's a psycho. And then it's usually because it's behaving out of context. So when an individual starts to have abnormalities in thoughts, if for instance, I start to think that because you're looking at me in that way, it means you want to kill me. Or I stop eating food at home because I believe that my relatives want to harm me. Or I look outside and I say it's daytime and something bad is going to happen because it's daytime. So, normal things happen, but these individuals have a misinterpretation or a faulty interpretation of normal things around them. So when there's an impairment in reality testing, you say that an individual is psychotic.
So how can we tell when someone is really, really psychotic?
All right, well, it takes maybe not much of a high index of suspicion, but you'd see a deviation from their usual behavior. For instance, if we had been friends for many years and I could share your things, all of a sudden I start to tell you, I can't use your red shoes because I think you took them somewhere for something. So you start to hear abnormal belief systems where an individual believes that maybe they are being targeted or they feel an exaggerated self-esteem. Let me give an instance. For instance, they say things like, oh, my people from the village I saw a black cat yesterday night and I believe it's people from the village. That's a form of psychosis, which is called a persecutory idea or a delusion. Or for instance, I look to you and I say, I'm the president of Nigeria. First, I'm female, and we know the president is male and his name is Buhari, but I insist that that's who I am. So psychosis can take different forms, but it could also take the form of what we call a hallucination or a delusion. Simply put, hallucinations are abnormal experiences that individuals have. For instance, I tell you, I can hear the voices of people who are not here talking to me.
But the person actually heard?
Yes, they actually do hear. They can hear voices, they can see things that other people can't see, they can smell things that other people can't smell. So hallucinations can occur in any sensory modality, bearing in mind that we have 5 sensory modalities. And then psychosis can also come in form of delusions, which are beliefs that the individual holds on to and that cannot be explained by either their social, religious, or educational background. For instance, me telling you I am the president of Nigeria, that can be explained.
Okay, let's talk more about the hallucination, that some people can hear or see things that other people can't see.
Yes.
So is it not true to them?
Well, unfortunately, because there's a disordered mind at that time, yes, it's going on. But it's also goes to show that there is an abnormality of the brain at that time. Because all of us perceive things. For instance, I can see you, I can see that you're light-skinned, I can see what you're wearing. But when you now start to perceive things that are not in, they're not in the environment. For instance, when I start to say, oh, I can hear the tap dripping water and the tap is talking to me, or that I can see color, or of course you see color, or I can hear color, or I can taste sound. That's unusual. It's beyond what you'd usually expect those sensory organs to do. So when those things happen, you say there is a hallucination.
What can possibly cause this?
Well, there are a myriad of mental illnesses that are associated with psychosis, and it would be anything from as simple as maybe a depression to schizophrenia, substance use disorders, head injury. For instance, somebody might even have an infection, an overwhelming infection, which is medical, not exactly psychiatric, and they go into what is called a delirious state. So any condition which is disabling enough, either medical or psychiatric, can actually result or show some evidence of some psychosis.
And those people, when they are treated medically, they do respond.
Yes.
They do respond.
Well, many patients do respond. It's important to state that patients can respond. However, their response is also dependent on quite a number of factors. For instance, time of presentation. If you have a patient who started hearing abnormal voices a week ago, as against one who started hearing voices 10 years ago, your guess is as good as mine as to who would get better fast. So factors like, time of presentation, how long they've been ill for, whether or not they've received any form of treatment, and then their belief system, the family's belief systems as well, and of course, the place of culture and religion cannot be discarded.
Doctor, you mentioned schizophrenia. Can you talk more about that?
Well, schizophrenia is a disruptive disorder that involves problems with cognition, emotions, and other aspects of behavior. The individual it can start almost at any time of life. In fact, these days you can have children. There's early onset schizophrenia, which happens in young children. But most times you see it at about age 16 and above. Depending on when it starts, it's actually disruptive. And the pattern over time is that the individual may be able to cope, but in very severe circumstances, the individual may also lose functioning in all spheres.
How does it manifest?
Well, so if schizophrenia occurs, you'd have hallucinations, you'd have delusions, then you'd have other abnormalities in thoughts, in behavior, and there are different types of schizophrenia. The psychiatric Bible, like I like to call it, the ICD-10 or the DSM-4 will tell you that you can have the paranoid schizophrenia, where most of the things you'd be seeing are paranoid ideas. Somebody wants to kill me, somebody is after me, they want to use my destiny, Okay. Then you have another type of schizophrenia, which is called the hebephrenic schizophrenia. That starts very early, at about age 16, where the individual just starts to talk and laugh to themselves for no reason. And after a while, they deteriorate fast. So depending on the type of schizophrenia.
Okay, let's take a break.
All right.
Stay with us, we'll be right back.
Sometimes you may find that the individual is aggressive towards others and sometimes towards self, where you find things like maybe they are cutting themselves or attempting to commit suicide.
It's the end of the show.
Welcome back. We are discussing mental health with Dr. Abire. Doctor, how does it present?
All right, well, as diverse as we are as individuals, mental illness could also present in diverse ways. Specifically psychosis, yes, could present in diverse ways. So it could be from not speaking to anyone, being mute, refusing to communicate with anyone, or appearing as if the individual is in conversation with unseen persons, which of course may mean that he is hallucinating. Then sometimes you may find that the individual is aggressive towards others and sometimes towards self, where you find things like maybe they are cutting themselves or attempting to commit suicide. So mental illness can present in different ways in different people, depending also on the condition that the individual has.
How can they be helped?
Well, help is available, it's affordable, and it's important that people reduce the stigma and discrimination attached to mental illness, because the truth is a lot of people want to come forth, they know where to find help, but they would rather just sit down at home behind closed doors where no one knows what is going on. So there are centers all around the country. In Lagos, at least Lagos can boast of the Federal Neuropsychiatric Hospital Yaba. The Lagos University Teaching Hospital Luth also has a psychiatric department, and the Lagos State University Teaching Hospital also has. And then of course the primary care centers in Lagos too they're working towards provision.
So in the line of work, how big is stigmatization when it comes to
it's huge. And it's not just against the patients, it's even against the doctors.
Really?
And other mental health care workers. Your colleagues look at you and say, oh, that's the psycho doctor.
Wow.
Or why did you decide to go and do, or even in some families don't encourage relatives who say that that's their passion and that's what they want to go for. So the stigma it's heavy, it's everywhere. It's more than the stigma that you'd find with HIV, and it's better that we face the stigma.
Okay. So tell us a bit about it. How does stigmatization stop people from coming to get treatment?
Okay, well, you know the kind of culture we live in, where even before mental illness became a big issue, people will go to people's ancestors to find out if there was mental illness or some other kind of illness. So people they're ashamed, they're worried about what people will say, they're worried about how people will perceive them, they're worried about the opportunities that may come to them but that individuals won't let them get because they have a mental illness. So it goes from as simple as, you can't do this job because people are not sure that when you smile, you're not smiling too much. Or when you say you want to do this, people are not sure that it's your mental illness. So people would rather just keep quiet about it. And of course, the silence does not help. So of course, talking about it like we're doing now would help to eradicate the stigma and discrimination towards people with mental illnesses.
What kind of cases have you seen
Oh, wow.
of people not coming up?
Wow. Well, in my short life of psychiatry, I've seen quite a lot. I've seen cases of relatives locking up their family members for as long as 20-something years just because sometimes they really don't know where to get help, or they're not sure whether somebody has to stay with the individual, or at other times they just prefer to try traditional and religious means, and because they strongly believe that it's a spiritual problem. So people will do all sorts to chaining them, tying them, beating them with canes, and making them profess what they don't even have under probably the guise of exorcism. So all sorts, from not presenting to presenting, or presenting and not being seen for so many years.
What can possibly cause mental illness?
Well, the causes of mental illness are varied, but in psychiatry we like to look at things from a holistic perspective. So we'll look at things like biological causes, psychological causes, and social causes. For instance, a normal individual can have an accident, have an head injury, and after that starts to behave in ways that it would not normally behave. Or if you have a condition like hypertension and the individual has a stroke and the individual is unhappy that he can't lift his hand and his legs, he can slip into depression. Or you have a condition like dementia, which is a mental illness in its own. And then, psychological causes, you'd find things like low self-esteem, low confidence levels. You find things like personalities, people who have personalities where they need other people to validate them because they can't tell themselves they're good enough. Then, of course, genetic basis under the biological. Mental illness is known to run in families. And some other, maybe neurotransmitters, which are like hormones in the brain, things like that have been implicated for social conditions, which we should not neglect, especially because we're in the age of recession, unemployment, poor quality of life, living in densely populated areas where there's a lot of crime and uncertainty. All of these factors can lead to mental illness.
Genetics, that's
yes,
biological.
Under biological, yes, you have
social,
psychological, and social. Yes.
Have we covered social?
Oh yes, yes. Unemployment.
Okay.
Recession. Life events, and yeah.
So you mentioned that some of these mental illness can be as early as 16 years.
Yes.
So what are the signs that my parents should look out for?
Well, first of all, parents should be very at alert. Have a high index of suspicion. Know your child. Be your child's best friend. I always say that. I know it's hard because we're all chasing the money. We're trying to make a better life. But many times people chase the money and forget that these children are growing up. So even when they start to do things like hang around bad friends, bad company, maybe start to watch pornographic materials, start to miss school, parents may never even know. So it's important to ask your child questions, paint real life scenarios to them, hear what their responses are, make them responsible, give them money, let them account for things like that, know their friends, know where they go, and then sometimes just do random searches in their rooms, check their pockets, check their phones sometimes. And then some of these adolescents are actually quite young to handle some of the responsibilities we give. Sometimes you give a phone, an iPad, a laptop just because you can afford it without monitoring what they're actually doing. So it's important for parents to be involved in their children's upbringing, schoolwork, even if it's university, find time to visit your children.
Now let's talk about how it can be curbed.
All right, so, well, education is important. It's important to educate the populace. Even the individuals with mental illnesses have to educate themselves. Go on the internet, find out what exactly it's about. Relatives should also educate themselves. If a doctor has said something, don't just say, oh, it's not our portion or something. Read about it and find out how best you can give support to your relative. Find time to see a doctor, go to the hospital, look for care. And if the doctor says, oh, you have to be on this medication or you have to undergo some form of therapy, trust that they know what they're doing and they're trying to do the best for you.
Okay, let's take a break. We'll be right back.
You'd probably just want to encourage them to avoid stress, learn how to manage their day-to-day lives, not putting themselves under pressure. And of course, if they notice anything abnormal or unusual, or people start to tell them, because sometimes you never know, people tell you, then seek help.
It's the end of the show.
Welcome back. We are discussing mental health with Dr. Abire. Talking about the genetics. That is there any way that one can test to find out whether one is predisposed to mental illness?
Well, the most basic test is to have a relative that has it. A lot of neuroscience will tell you, oh, there are genes, there are enzymes, there are linkages on DNA, but the truth is, how many of that can we actually get done around here? So many times it's when you see that an individual in a family already has it, the rest are predisposed. It does not mean that for certain they will come down with mental illness, but it's just, yes.
Predisposition means that there are certain things you shouldn't eat, there are certain things you shouldn't do because this thing is there in your family.
Well, to not eat or not to do would largely probably be for physical illnesses. Okay. But in mental illnesses, you'd probably just want to encourage them to avoid stress, learn how to manage their day-to-day lives, not putting themselves under pressure. And of course, if they notice anything abnormal or unusual, or people start to tell them, because sometimes you never know, people tell you, then seek help.
Okay, the patient himself might not know. Someone has to tell the person.
Sometimes, I always say that how does the brain tell itself that it is sick? So many times the sick individual is unable to tell that, oh, what I'm doing is not right. To them, it actually does look right. So, which is why many times the individuals who are ill do not seek help themselves. People bring them to the hospitals.
A lot of secrecy surrounds or shrouds this mental health. A lot of people, and you don't get to know that this thing is happening to your neighbor or in your family, because in our society we tend to hide, like we mentioned earlier, we hide mental cares a lot. Is there anything that, how can we help in this kind of situation? Oh. Because once you have maybe a mental case in your house, to you it's strange because you've never heard of it. You've not seen it happen to your neighbor or anybody. What is the rate like? Is it high in our society?
Well, yes, it is high. The number of cases, new cases that we see on a daily basis are high. People are not talking as much as they should talk about it, but I must commend people. People are coming out now. Young people are actually coming out. If you've noticed, after the suicide happening, a lot of people have come out to say, oh, I went through depression, I survived. I went through depression, I overcame it. So people are becoming more comfortable in their own skin to talk about the conditions that they've been with. And I think that the more people talk about it, not because you're trying to tell everybody that you have a mental illness, but because you're also trying to find help.
Now, doctor, how do you go about this? Like maybe in your society or in your environment, you know some people that are like not scared. Say, don't go near her. We know how. You know how she is. Really, we kind of know that there's something wrong with the person, with the behavior and all that. Do you just let the person be, or how do you help such a person?
Well, it's the responsibility of everybody in that environment to take action, Because if you keep saying it's not my business, how do you know that one day you're not coming back home from work and something happens and this individual, you know, is involved, maybe runs across the road, you know, in a manner that you knock the person down or something else happens. So it's everybody's responsibility. Speak to the family members if you can find them. I know sometimes it can really be tough. Somebody once reported a case where a woman was disturbing the neighborhood. They had written to police, written to different people, and they still could not, you know, get the case sorted. She would wake up in the middle of the night and bang on the door. But I just kept encouraging them that just keep, you know, try and find a link to our relatives, whatever means that you can use, maybe at church, just get somebody who would care enough to take her to where she can find help. So it's important that everybody tries. Of course, it's not advised that you see somebody on the road and you grab them and you say you're taking them by yourself. Get in touch with authorities, maybe hospitals who are involved in such, like the hospitals I mentioned earlier, to attend to such people.
Doctor, is there another thing you want to add to it?
Well, in closing, I'd like to say that health. Many people believe that they're healthy because they haven't been to a hospital in 20 years or because they haven't had malaria in 10 years. But it's important to know that health is not just the absence of disease or infirmity, but a complete state of physical, mental, and social well-being. And of course, that there is no health without mental health.
Thank you so much, Dr. Abire.
Thank you.
It's the end of the show. Oh.